Hi, my name is Dr. Judith Joseph, and I'm a child and adolescent psychiatry resident at the NYU Child Study Center. Thank you for joining us for our Grand Rounds lecture series where we get to talk with the experts in the field of child and adolescent psychiatry. Today we have the pleasure of having Dr. Jeffrey Newcorn, and he is the Director of Child and Adolescent Psychiatry at Mount Sinai Medical Center and the Mount Sinai School of Medicine. Thank you for joining us.
Thanks very much for having me.
So in your talk about ADHD, you talked about how ADHD affects kids across the board. Tell us more about that and why it's so important to treat ADHD.
Well, ADHD affects people of all ages, not even just kids. And it can present very early in preschool years, and often does in one way or the other, and extend into school age years and into adolescence and into adulthood in the majority of cases, but not all. And it's important to treat it because it causes problems for people. We're not solely interested in reducing symptoms because we all have some problems that sound a little like ADHD and are partly like ADHD. We treat the impairments that these symptoms produce. So people that have trouble functioning in school or functioning in certain kinds of social settings because of their ADHD are candidates for treatment.
And what are some of the treatments for ADHD?
Well, there are a variety of treatments. There are both, I should say first, there are both medication and non-medication treatments. And there are now evidence-based psychosocial treatments that extend across the lifespan. In children, it's behavior management therapy is the best supported treatment. And in adults, there are now CBT-based programs for organizational training, which can be quite helpful. Clearly, the important thing is trying to match a treatment to the individual needs of the patient.
That's great that there's so many options for treatment. So what do you do when a parent says, my kid just won't take the medication?
Typically, that kind of a discussion is going on with older kids or adolescents. And there it's important to understand the issues and the reasons. Does the person not think they have a problem? Does the person not like the way they are on medicine? And it's very important to embrace that, both from the point of view of understanding, having that person understand that they're a participant in this, and it's about them, and how could we do something about them that doesn't include them. And there are sometimes subtle or sometimes not so subtle problems about using medicine or taking medicine that can affect whether someone wants to do it. And this is not a trivial problem because we know from studies that the majority of kids who are prescribed medication for ADHD aren't taking that medication a year later. And it's interesting and almost a little amusing because people will often ask you, what's the best medicine for ADHD? Of course, one of the answers is that the best medicine is the one the person will take. Because you can't help anyone if they're not taking their medicine.
So what should we tell parents when they're concerned about their child being addicted to ADHD medications?
There has been some suggestion in the literature that stimulant treatment could even be protective of later substance abuse. And it's easy, actually, if you sit down and think about that, to understand how that could be true. If you think about the kinds of circumstances that will predispose an adolescent or even a younger child to abuse substances, you think about being disenfranchised, you think about running with a negative peer group, you think about academic underachievement, you think about low self-esteem, and to the extent that some of those factors could be ameliorated by taking stimulant medicine if you have ADHD. In some ways that might help you, and it might offer a certain amount of protection. But on balance now, as the data have come in across studies, in the main, what we see is that there isn't really a big change in risk, pro or con, from taking stimulant medicine. So the factors are many, and I think that people can be relatively comfortable about the safety and the risk-benefit ratio in this area.
Thank you so much for talking with us. We learned so much.
Well, it's been a pleasure.